Hi, is prolonged sitting at the workplace hurting our lower backs? Since the Industrial Revolution, almost three-quarters of the workforce is forced to sit in cramped spaces for as long as 6 to 8 hours a day. This takes the enormous toils on our back. The reason being that the back is not supported, the gluteal muscles are not firing properly because the hip flexors are shortened. As a consequence, under the scope of work, we are forced to overexert our hamstrings, and this results in an abnormal posture of the pelvis tilting forwards, resulting in an anterior pelvic tilt. Secondly, many of us, like crane operators and heavy machinery operators, have to work in confined space and they have to adopt awkward postures which are required for their work. This associated with vibrations which are being transmitted from their heels and from their seats result in whole body vibrations, which is a phenomenon scientists are studying effectively to see its effect on the lumbar spine. Sitting alone does not increase the risk of low back pain, but if it is accentuated by whole body vibration and awkward posture, the risk of low back pain increases fourfolds. So, what can be done to reduce the morbidity associated with prolonged sitting, which, amongst other things, includes type 2 diabetes, multiple cancers, cardiovascular, and metabolic consequences? The first is to make sure that your back is supported when you are sitting. You can have a cushion or you can keep it as straight as possible. The second is to avoid slouching forward. The third is to make sure that your heels are resting on the floor and the knees are above the level of the hip. Whenever possible, try to squirm literally in the seat you are sitting on to reduce the pressure on the intervertebral disc being constant. And whenever you can, try to take short breaks even for a few minutes by getting up and walking around. Keep yourself hydrated well during these long hours of work because prolonged sitting is also associated with dehydration of lumbar discs.